Hi everyone. I'll be teaching you the principles of safeguarding in health and social work. And my name is Syed Taj, and I've been teaching since 2007. And I have done a lot of courses. I did my MBA in accounts and finance. I did my BA honors in uh, healthcare management. Plus, I have done PGCHE, DET, QTLS, and apart from that, I have done assessment and the IQA courses as well. So I'll be teaching you mm, this nursing, uh, Ascentis level 3 nursing class, and so I think no one is online at the moment. So I'll begin my class. So now the first one, as we have the topic, and if we have any participant, no, not at the moment. I hope my screen is properly visible to everyone. And right, I have shared my screen, and you may have been uh, not sure because no one is online at the moment. Um, I'm sure that everyone able to hear me properly and uh, able to watch my screen. Right. Uh, so I'll start my lecture. And now, as you can see on the screen, that this is our first slide that is about the topic and the unit. So we will be going to discuss about the learning outcome one, which is understand how to recognize signs of abuse or harm. So I'll begin my lecture. So again, I'll say hello to everyone and welcome to our online class on the principles of safeguarding in health and social care work. Um, Today we will explore the key principles that underpin safeguarding practices and discuss how they apply in real world scenarios. So before I begin, if anyone uh, online, can I ask, does anyone know what is safeguarding? Right, we have a participant. So morning, can you hear me? The recording is in progress. So
Yes.
good. Good morning.
Mm.
So, I have introduced myself before. So, I'll be teaching you the principles of safeguarding in health and social work. And my name is Saeed Taj, and I'll be delivering this course to you. So, that would be the first learning outcome for this unit, and which is understand how to recognize signs of abuse or harm. So,
Okay.
welcome. So I'll start again then. So we will explore the key principles that underpin safeguarding and discuss how they apply in real world scenarios. So do you have any idea what is safeguarding?
Yeah, I got an idea because I'm doing a care home. So I
Good.
did some some training about it, but it's fine.
Right. Brilliant, brilliant. So we'll start our lecture. So we'll go to the next slide. What do we have? Okay, now we have what is safeguarding and about the CARE Act statutory guidance, which defines adult safeguarding. So for that, what we can say is safeguarding is the action or process of protecting individuals and particularly vulnerable adults and children from harm, abuse, neglect, or exploitation. So it does not only involve adult, it involves every person whom we are related with, and it involves putting measures in place to ensure the people are safe from any potential risk to their health, well-being, and human rights. So it involves all the aspects. Safeguarding is a fundamental aspect of health and social care work, and it is everyone's responsibility to ensure that the people in their care are protected from harm. Not only in their care, in general life, we will also protect each and everyone. And so these are the main like points regarding the safeguarding. And there are six principles of safeguarding which we establish as a part of the CARE Act 2014 in the United Kingdom. So basically, like as it's mentioned in the slides, that safeguarding is a term used in the United Kingdom and Ireland. So which measures to protect the health, well-being, and human rights of individuals. So, as we are in the UK and we have the CARE Act 2014. So, the CARE Act, CARE Act designed to protect vulnerable adults from abuse and neglect. These principles are widely adopted in health and social care setting to ensure a consistent and effective approach to safeguarding. When we talk about the six principles of safeguarding, then what they are first we will say that we have that empowerment. So, what is empowerment then? Empowerment is supporting individuals to make their own decision and giving them the information and support they know they like what they need to do so. So this is about respecting people's rights and self-determination. And in the meanwhile, if you have any question, then you can ask, and I'll try to answer that question as well. So, in the second point of the six principles of safeguarding, um, we have prevention. And what is prevention? Prevention is taking action to prevent harm or abuse from occurring in the first place. So, we will prevent it. This involves proactive measures to identify and mitigate potential risks. So everything which we do is for the prevention purpose. And then we have proportionality, and which involves ensuring that any response to a safeguarding concern is appropriate to the level of risk and seriousness of the situation. What does it mean? This means that balancing the need to protect someone with their right to make their own choices. And then we will uh, have uh, we have protection. Okay, so now we have the protection. So protection is providing support and support to those who are in greatest need, and this involves taking steps to ensure that individuals who are at risk of harm are kept safe and their welfare is prioritized. Then what we have partnership. So for partnership, we can say that um working with other agencies, professionals, and individuals themselves to ensure a effective approach to safeguarding. Uh, This recognizes that safeguarding is a shared responsibility. Like again, everyone is involved into that. And the last one is the accountability. So, what does accountability mean? Whether it's regarding with the safeguarding or anything else in our life, it's being transparent and accountable for actions and decisions related to safeguarding. This includes having clear rules and responsibility and ensuring that there is oversight and safeguarding practices which we practice at our place of work or in journal life. So this was about this slide. Then we have the roles and responsibilities of safeguarding. Um, with this, we have providers of health and social care services should ensure they have the key people, relationship, values, and system in place that will help them keep the people they serve safe. And now we have some bullet points. You can go through with the, like all the students can go through with the bullet points. I'll try to explain the important bits from that. So with this slide, we can say that engagement with the safeguarding adult board. So we call it as a SAB, a Safeguarding Adult Board. So health and social care providers must actively engage with social or the with the local safeguarding adult board, and these board help coordinate and ensure efficiency of safeguarding across different organizations. So can I ask a question? Like actually, you are the only one. Um, do you know why it is important for a care home to engage with safeguarding adult board?
Sorry, repeat again.
Why it is important for a care home to engage with safeguarding adult board,
Is is it to is to protect yourself? I think so.
right? And it is to protect ourselves, both the service user and ourselves, and it ensures that they are up to date with local safeguarding strategies and can participate in multi-agency responses and contribute to the development of best practice. You are
Yeah.
right. And now the second point is the up-to-date functional policies and procedures. Uh, like organization must have current policies and procedures that outline how to respond to safeguarding concern. These should be regularly reviewed and updated. And if we say that what might happen if a care provider safeguarding policies are outdated, so that would be a big problem. It could lead to mm, so much trouble that the responses to safeguarding issues will potentially put client at risk or harm. So that is very dangerous. And like we can say that clients who understand safeguarding and help shape responses to it, it's crucial that clients are informed about their rights and what safeguarding means. They should be involved in shaping how safeguarding responses are developed and implemented. So we need to include the service user or the client as well. And if we say that, how can involving service user or clients in shaping safeguarding responses benefit them? So wherever like we have in the care provision or any profession related with the health or social care, so we involve the service user or the client. So what it does, it empowers them and ensures their needs and preferences are considered and can make safeguarding measures more effective. Now we'll discuss about safeguarding lead. So every organization should have a designated safeguarding lead. This person would coordinate safeguarding activities, ensure staff understand their responsibilities, and act as a point of contact for concern. So it's not only with the um, service in the social care or healthcare environment. Like in schools, we have designated safeguarding lead. So in the United Kingdom, we have safeguarding lead in all the important organization. And apart from that, it's the responsibility of not only the safeguarding lead, every individual is responsible. So if you say that what qualities should a safeguarding lead possess, so we can say that knowledge of safeguarding laws and practices, good communication skill, leadership qualities. So these are few of the qualities which a safeguarding lead should have. And like in safeguarding and the MCA, what does MCA mean? Mental Capacity Act. So staff should be trained not only in safeguarding but also in understanding the Mental Capacity Act, which plays a crucial role in protecting vulnerable adults. So we should always consider the capacity, mental capacity of a person, and then we will act accordingly. And like Mental Capacity Act is important. Why it is important? It helps staff understand when an individual might lack the capacity to make certain decision and how to act in their best interest while still safeguarding their needs. And we generally do the Mental Capacity Act for every individual or the service user which we serve. And if we discuss about the information sharing protocols that support the supply of information to the SAB, and which is like effective safeguarding require appropriate sharing of information between organizations, and protocol should facilitate this while respecting confidentiality. So this is like very important. We always keep confidentiality. And now we'll discuss about the integrated cooperative working with other parts of the sector. Safeguarding is most effective when different sectors work together, including healthcare, social services, and law enforcement. Plus, uh, like if I say that, how does cooperative working enhance safeguarding? So, what it does, it allows for a more comprehensive understanding of an individual need and risk, and which lead to better care and protection. Now, the important bit is this as well, like the with the section 42. Um, Section 42 is under the Care Act 2014. The scope to engage with or lead Section 42 inquiries. Uh, they provide the provider should be prepared to engage with statutory requirement and inquiries under Section 42 of the Care Act 2014, which concern protecting an adult at risk of abuse or neglect. Now, uh, like if we say that what role do care providers play in Section 42 inquiries? The providers, they provide vital information, support the individual involved, and implement recommendation to prevent future harm. Now, the next point is knowledge of when to report concern and who to report to. So, staff must know how to recognize signs of abuse or neglect and understand the procedures for reporting these concerns. And if we say that why it is important, timely reporting of safeguarding concerns is necessary. So because it ensures the risks are addressed immediately, reducing the chance of harm and potentially saving lives. So now, if we discuss about the a balancing choice, control, and safety, so what does it do? Um, like Safeguarding should balance an individual choice and control over their life with the needs to ensure their safety. And what I have missed is So, and this is about that, and I hope I have covered everything from this slide. Okay, so we have a video to watch. We'll watch this video.
There's no volume.
No volume. Oh.
No.
Picture, picture. Honestly, I don't have any idea how to um, turn on the volume, but I can hear from my side. But I believe that you all have access to the um, slides, so there you can watch it. I'm really sorry for that. So
Yeah.
move to the
I
next.
think if the website is there, we can, after we finish, we can go and click on it and then watch it from there.
Yeah.
Yes, 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 please. Thank you, thank you. So now we have the what does it say? Define three of the following type of abuse. Okay, so now we have list of sort of abuse, like which we have bullying, emotional abuse, financial abuse, institutional abuse, neglect by others, physical abuse, psychological abuse, self-neglect, and sexual abuse. So we'll discuss them. Uh, right. So, mm, like I'll try to define it in simple words. So, for example, they're asking for three of it. So, for example, if we discuss bullying, so it's a repeated aggressive behavior intended to hurt or intimidate someone, often involving an imbalance of power. So, and if we say about emotional abuse, so emotional abuse is causing emotional pain or distress through verbal or non-verbal acts such as insult, threats, or isolation. So, if we discuss about financial abuse, so financial abuse is misusing or controlling someone's money or asset without their consent or for personal gain. Then we have institutional abuse. So, institutional abuse is mistreatment or neglect occurring while an organization like a care home or hospital or any place of work, often due to poor practice or policies, they neglect the service user or the staff, and neglect by others, which is failing to provide necessary care, support, or assistance to someone, leading to their harm or discomfort. Then we have mm, physical abuse. So the physical abuse is influencing the physical harm or injury on someone through actions like hitting, kicking, or burning. So physical abuse can be of many types, and which will be visible. Um, and then we have the psychological abuse, and which is not always visible, and that is damaging someone's mental well-being through actions like manipulation or threats. uh, then we have self-neglect. Self-neglect is when any individual fails to take care of their own basic needs, health, or safety. So, self neglect is for us, for everyone individually. And then we have sexual abuse. So, it involves any non consensual sexual act or behavior towards someone, including touching, rape, or exploitation. Um, this is all about it. Then we have the types of physical abuse. So, as I discussed before, that I only mentioned few of the bits. So, um, here we have a list of types of physical abuse, which involve assaulting, hitting, slapping, punching, kicking, hair pulling, biting, pushing. So, we have a list of physical abuse, which will say that um these are related with the types of physical abuse. What we have, types of domestic violence or abuse. Right. So domestic violence or abuse can be characterized by any of the indicators of abuse outlined in this briefing related to. Right. Okay. So we have the guidelines as well here. So if you click on this link, and then you will see the guidance about recognizing domestic abuse. So, but before that, um, mm, I would like to like explain to you what is domestic violence or abuse. So, domestic violence or abuse is a pattern of behavior in a relationship that is used to gain or maintain power and control over an intimate partner or family member. So what it does do, it can manifest in various form, and which involve like physical, emotional, sexual, financial, psychological abuse, and domestic violence or abuse can occur in any relationship, regardless of age, gender, sexual orientation, or socioeconomic status. And it involves a cycle of abusive behavior where the abuser uh, try to control over the victim, leading to a dynamic fear of dependency. The impact of domestic violence or abuse can be severe and long lasting, affecting the physical and emotional well being of the victim, as well as their ability to lead a safe and healthy life. So, it is like very important for us to recognize the signs of um, domestic violence or abuse. So now, for example, if we have the types of sexual abuse, I discussed what is sexual abuse before, and we mentioned few of the points as well. So we have here some bullet points which involves like uh, the sexual abuse involve rape, attempted rape, or sexual assault, and inappropriate touch anywhere. So we have these bullet points related with the types of sexual abuse, and then we have types of psychological or emotional abuse. So like again we discussed that in the psychological or emotional abuse which we cannot see, these are not the physical, we can see it physically. um, these are the psychological or emotional abuse which we cannot see, but there are a lot of victims or people facing these issues, so we need to find those problem and then report to the safeguarding lead or any organization or agency which could help the victim. So like it's our shared responsibility. It's not only for the safeguarding lead or any individual who's involved in the safeguarding team. It is whether we are working as a healthcare assistant, or we are the manager of that organization, the care facility, or the nursing home, or anywhere. It's a shared responsibility as a carer, even as a lecturer, as a tutor to you. My responsibility also to, if I notice any types of psychological, emotional, or any kind of abuse, then it's my responsibility to report it. So these are the things. Like types of sense. So we have those bullet points, and we can go through it uh, in the bullet points. Then we have types of financial or material abuse. Again, with the type of financial or material abuse, we discussed earlier that um, that involves um, inappropriate use of financial matters or material. So, what could happen in this is theft of money or possession, fraud, scamming, preventing a person from accessing their own money, benefits, or assets. We have a few of the case studies related with that. Some of the um, like uh, healthcare support staff or anyone involved in taking care of an individual or a vulnerable adult, or even those who have those financial means, they try to um, rob them, they try to theft money, or like do something fraud or scamming to them, because people are vulnerable due to old age or any other health issue. So we have those type of case studies. So it is very important as a carer, nurse, or anyone involved in health or social care industry, that we should be able to uh, recognize the types of financial or material abuse. Then we have types of modern slavery. Okay, so for that, we must have heard about, previously we have those slavery in our culture, in like most of the people, in the past, they were dealing with it, but now it's a modern slavery, it's a modern world. So in that modern world, what it involves, the slavery involve modern slavery involves, like for example, human trafficking. So that is what is human trafficking is the act of recruiting, transporting, transferring, or or receiving a person through force. Um, so that is and it is for the purpose of exploitation. So that is human trafficking. Then we have forced labor, making someone work against their will, um, and then this is also important, like domestic servitude. So that is forcing someone to work as a household servant or maid in private home under conditions which resemble slavery. Then again, in modern slavery, we have sexual exploitation, which we discussed before, again, which involves exploiting someone for sexual purposes. And if we discuss about debt bondage, so what is debt bondage? So it's the making someone work to pay off a debt, often under condition where the debt is impossible to repay, leading to a cycle of exploitation. So again, we have a link from the gov.uk website, and that has the more information about identifying and reporting modern slavery. So we have types of discriminatory abuse. Okay, so now here we'll discuss about unequal treatment based on age, disability, gender, and reassignment, plus marriage and civil partnership, pregnancy and maternity, uh, race, religion and belief, sex or sexual orientation. So these are known as protected characteristics under the Equality Act 2010. So, like again, in the United Kingdom, we have few laws to follow as a healthcare provider or anyone involved in taking care of someone. So, one of that is the Equality Act 2010. And please make sure whenever you will do your assignment, so whenever we are discussing about any uh, act or law, so we name it correctly with the year as well. So for example, if we are discussing about the Equality Act, we'll write it as Equality Act 2010. And for example, few of the regulation, they have the updated version of it. Whenever you are doing your assignment, make sure that you check the latest or the updated version of the act or the law. um, like previously we used to follow Health and Social Care Act. Now we have Health and Care Act, which was updated in 2022. So most of the time when you search the information from Google or any other search engine, if you type about like mm, some question and you'll search about it, so they might give you the old act. It would write as Health and Social Care Act. So mm, it's like as a student, we should know the latest version or the updated version of the act or the law. So please always double check that whatever legislation you are referring is the updated one. So this is about the types of discriminatory abuse, right? Then we have types of organizational or institutional abuse. Okay, so we have a huge list of organizational or institutional abuse, which is discouraging visit or the involvement of relative or friends, rundown or overcrowded establishment, authorization management or rigid regimes, lack of leadership and supervision, insufficient staff or high turnover resulting in poor quality care. So they are it's not only related with the health and social care industry, with any industry it's related with. And abusive and disrespectful attitudes toward people using the service, then inappropriate use of restraint, lack of respect for dignity and privacy. So we have so many bullet points here, so which you can go through by the slide by yourself as well. And if you have any like concern, any question regarding these bullet points, you can ask me. And this is about the types of organizational institutional abuse. Then we have types of neglect and acts of omission. So again, we have a list for that, and which is the failure to provide or allow access to food, shelter, clothing, heating, stimulation, and activity, personal or medical care. Uh, then we have the second bullet point, providing care in a way that the person dislike, failure to administer medication as prescribed, refusal to access uh, to visitors, and not taking account of individual cultural, religious, or ethnic needs. So again, these are really very important as a carer, nurse, or anyone involved in health or social care. Uh, so again, like I have also worked in the care homes and nursing home as well. Plus, I've been teaching this, so um, we always try to take care of the cultural or the religious or the ethnic needs of the service user. For example, I have many uh, Muslim service users, so they prefer halal food. So if then there's meat involved in it, so we need to focus on their need and provide them halal food. And like even if it's not for Muslim, like some people have their um, culture or individual um, like requirement that some people are vegetarian, so we need to take care of it. We need to consider their request, and then we'll provide them vegetarian food. So these are the sort of type of neglect which may occur by the care provider. So we should be able to um, like um, we should be able to um, cater the religious, cultural, or ethnic needs of individual. So then we have types of self-neglect. Okay, we discussed it earlier as well. It's related with the individual, him or herself, and that involves lack of self-care to an extent that it threatens personal health and safety, neglecting to care for one's personal hygiene, health, or surrounding, and ability to avoid self-harm, inability to avoid self-harm, and failure to seek help or access services to meet health and social care needs, and inability or unwillingness to manage one's personal affairs. So we can also go through that link, and we will see what it has. And then we have, right, okay. So in that slide, what they are asking is, identify the signs and symptoms identified with three types of abuse. Let's look at three types of abuse we have studied in previous slide and discuss the sign and symptom, how to recognize the abuse happening. So types of psychological or emotional abuse. Right. So we have again so many bullet points here. So I'll try to explain in my own words. Like for example, enforced social isolation. Uh, what does it involve? This involves preventing someone from accessing services, educational and social opportunities, and seeing friends. Um, and right, then we have uh, what will be the sign and symptom for that? The person may appear lonely, withdrawn, or disconnected from their usual circles. Then we have removing mobility or communication aid. So for that, like every abuse uh, has some signs and symptoms, whether it's physically visible to us or not. In case of emotional or psychological abuse, so we need to see the signs and symptoms. For example, in that removing mobility, we can say that the individual may struggle to move around or communicate effectively, leading to increased dependence and isolation. Then we have preventing someone from meeting their religious and cultural needs, which we discussed earlier as well, and we gave example of the halal meat or the vegetarian food choice. So again, what would be the sign and symptoms? Uh, the person may show signs of distress, frustration, or loss of identity, and like sometime we have a service user who's unable to speak properly due to language barriers, or we can say that due to some health condition. So we need to identify those issues and rectify them. Then we have preventing the expression of choice and opinion. Uh, in that, this occurs when an individual choices and opinions are ignored or dismissed. And then we have failure to respect privacy. This is again really important. We always need to take consent from the service user, and what it involves. This can involve um, uh, like uh, mm, taking someone personal space or affairs without their consent. So we always take consent. before providing any treatment to any service user. Uh, then we have preventing stimulation or meaningful occupation or activities. And what would be the sign? The person may seem bored, disinterested, or like cognitive decline would also be there. Then we have a huge list here again. That is intimidation and harassment, use of threat, simulation. So, what would be the sign for those is the individual may display fear, uh, low self-esteem, and signs of trauma could be also there. Then we have threats of harms or abandonment. So, what it is making someone fear of their safety or the loss of support. The signs or the symptom would be the individual may appear fearful, overly reliant on the abuser, um, something like that. Then cyberbullying. Okay, now this is again in the modern world. It is important, which involve using digital platforms to harass, intimidate, or bully someone, and especially the youth is uh, very affected by the cyberbullying. It's not only the youth or the youngsters; it's with everyone, any vulnerable person. But like it could happen, and so we need to look for those. Um, and if we say that what might be some emotional signs that someone is experiencing psychological abuse, so again, the answer would be like emotional sign can include depression, low self-esteem, fearfulness, or a sense of hopelessness. Um, Again, these are the psychological or emotional abuse which we cannot see. So then how can we support someone who is suspecting or experiencing psychological or emotional abuse? So it is like very important that we support those individuals, and we can offer a listening ear, provide emotional support, encourage them to seek professional help, and provide information on resources and services available to them. And always we should remember that uh, um, the recognition of psychological or emotional abuse is the first step in helping someone get the support they need. And for example, if in at your workplace, if you suspect someone is being abused, so it is important to approach the situation with sensitivity and offer support in a non-judgmental way. So that is very important, and then you may escalate the um, concern or any sort of um, abuse you have noticed. You may escalate it to the safeguarding lead or your manager, whoever involved in the safeguarding team. So but as a carer, as a nurse, it's your duty to um, like find out, uh, like see go through with the like the mm, you can say that the signs and symptoms of it, and then you will escalate it to your manager or the safeguarding team or the lead. So now we have signs and indicators. So withdrawal, insomnia, low self-esteem. Again, they are talking about uh, the types of psychological or emotional abuse, so which we have gone through. Mm, there are some different bullet points like a change of appetite, weight loss, weight gain, signs of distress, and an year of silence when a particular person is present. Right, okay. So if someone is uh, controlling a individual, then there might be something like which we can notice. The sign or symptom would be that there would be a silence when a particular person is present. Um, so these are few of the signs and indicators. Then we have the types of domestic violence or abuse. Then, right, we have gone through the definition of domestic violence and signs and indicators. So again, in this slide, they are mm, discussing about the types of domestic violence or abuse, and we have a few of the bullet points. Again, those domestic violence or abuse that would involve psychological, physical, sexual, financial, emotional abuse, and we have those. And then signs and indicators. So again, low self-esteem, feeling that abuse is their fault when it is not. Sometimes, like, yes, people manipulate other person, and and the victim always feel that the abuse is their fault when it is not. So some people play the mind game with the victim. So there could be many signs and indicators for that. So we need to again look for them. And now we have again signs and indicators. Domestic violence and abuse include any incident or pattern of incident of controlling, uh, coercive or threatening behavior, violence or abuse between those aged 16 or over who are or have been intimate partners or family members, regardless of gender or sexuality. It involves, it includes so-called honor-based violence, female genital mutilation, and forced marriages. Again, there are many signs and indicators which we need to consider, and these sort of problems or the abuse is like most of the um, people are following it in most of the culture countries. So we need to look for the signs and indicators. Then you have types of physical abuse. Uh, okay, in that we can say that the signs and indicators of physical abuse, uh, that is a serious issue in health and social care setting, and physical abuse involves using force to cause harm or injury to another person. And it's important to recognize the signs of physical abuse so we can take appropriate action to protect and support the victim. So again, because these are the physical abuse, so we may have the sign and symptom visibly, we can see them. um, like for example, we have assault, hitting, slapping, punching. For example, if we discuss about the example assault, we'll say that hitting, slapping, punching, kicking, hair pulling, uh, biting, pushing, right? Rough handling. Rough handling is handling someone in a rough or aggressive manner. Then we have scalding and burning, which is causing burns or scalds through hot object or liquid. Um, then we have physical punishment. Physical punishment using physical force as a form of punishment. Then inappropriate or unlawful use of restraint. Um, then like it is restraining someone in a way that it is harmful or not legally permitted. Then making someone purposefully uncomfortable, and they have given us the example as well, uh, opening a window and removing blankets. So uh, right, then we have involuntary isolation or confinement, and which involves isolating or confining someone against their will. So forcible feeding or withholding food. Again, we have the sign and indicators for those abuse as well. So, for example, uh, no explanation for injuries, or the person may have bruises, cuts, or other injuries without a reasonable explanation, and injuries inconsistent with lifestyle. The person injuries don't match their uh, normal life activity or lifestyle, something like that. Then bruising, cut, welts, burn, marks on the body that indicate physical harm. Then we have the physical frequent injuries. The person has a history of frequent or unexplained injuries. So again, we need to look for the signs and indicators. And if we say that uh, as a caregiver or as a care worker, for example, how we might recognize the sign of physical abuse in a service user or a patient. Like as a caregiver, we can look for unexplained injuries, changes in patient behavior, signs of malnutrition, and any inconsistency in the patient explanation for injuries. Whether like mostly we have, for example, if we are working in a um, care home which has in-house children, there might the we have those issues as well. And sometime like uh, when we visit some service user at their home, we may see these sort of issues. And for example, um what should we do if we suspect someone is being physically abused? So we need to, if we suspect physical abuse, and we should report it to appropriate authorities such as a supervisor, safeguarding team, or social services, and ensure the victim receive medical attention or like any sort of support which they need. And it is like very crucial for us to proactive in recognizing and addressing physical abuse to ensure the safety and well-being of those in our care. And if you have any um, like if you see any issue or any concern, then we should report it. So the next slide, we have the references. So I believe these are not like the Harvard referencing which we usually do in our assignments. So these are the links. So like to better understand the topic, we can go through these links. We'll click on that and then we will be on the page where the information has been taken from. So it's a good idea to have those like sites mentioned in the slide. Plenary we have, okay. Right. So I think we have covered all the slides. And if you have any question or concern, you can please ask me. We have 4 participants. Any questions, students?
No questions.
No question. Okay.
I
So
think most of us didn't know that there was class today, so maybe
Yeah.
from tomorrow they will come. Yeah.
uh, okay, fine. That's fine. So we'll finish the lecture then, and I would like to thank all of you for your active participation. And it's been a pleasure discussing these important points and topic with you. And I hope that you have found the information valuable and thought provoking. So, and I will encourage all of you to reflect on what we have covered today and consider how we can apply this knowledge in our practice or studies. So, uh, I'm sure that we need to follow the Harvard referencing in our assignments. So,
Okay.
but please do make sure that you check the assignment brief, and we need to follow those instructions. For example, if they have any specific requirement for font style, for example, some assignment briefs say that the assignment should be in Arial size 12, line spacing should be, for example, 1.5, something like that. So we need to take consider these points as well. and maybe they will ask for a PDF file as the submission, or they may ask for Microsoft Word file. So again, not only with the lectures or topics as lecture, if you need any like one-on-one help with me for the assignment or anything, you can like discuss it with me as well. And always, like, we need to remember that the learning, it never stops, and we need to continue to explore. And like, I'll wish all of you best of luck, and have a wonderful day.
Thank you. Are you at the office as well?
No, no, I'm not in the office. It would be an online, I will be an online lecture to you, but I'll mark, I believe, your assignments and do the mm, marking, and I
So
can.
if for instance, if I need any help about this topic, how would I contact you?
Uh, Honestly, like, this is my first class, so uh,
Okay,
you
we'll
can
meet
discuss
tomorrow.
it
So
with the, yes, with the management, and then they may share you my details or any point of contact. So I'll happy to help you with that.
okay.
Okay, thank you.
Thank you, thank you,
Thank you.
thank you. Take
Bye.
care. Bye, bye.
Thank you. Bye.
Thank you. Welcome. Bye.